first and foremost, like disbelief and worry. And the disbelief part from mainly that here in the United States, we had essentially eradicated measles. And so while this is something that we studied in public health school, it wasn't something I actually thought I'd be, acting in as a response or participating in as a response. Maybe a case here or there, but never an actual large scale response. And so disbelief in that we actually were going to possibly see this in North Carolina. And as we watched more and more cases across the country, and we watched large-scale outbreaks across the country unfold, that hypothetical of what if it happened here became much more of a reality. And then that's where the worry comes in, is that the worry of primarily measles impacts children. And so the worry for North Carolinian who are children, and that meant the worry and how we will sort of make sure that we're communicating important pieces to obviously their families, their caregivers, their schools, their providers. And so really started thinking through, how do we plan now? How do we plan for this? Not the what if, but the when. We didn't wait for measles to be here in North Carolina. When we started seeing the first cases, even in Texas, that's when we started planning. And when I say we, I don't just mean the Division of Public Health. I mean we, the public health system of North Carolina, which includes both locals and state. For our part at the Division of Public Health, that meant really thinking about how we were going to communicate, engage with our partners, and our most important and biggest partner being local health departments. But also how are we going to communicate with the public, and how are we going to communicate with the healthcare provider world? If you want to get ahead of any type of communicable disease response, you have to have the testing in place, because that is what sort of leads to everything else. So we really focused in on our state labs' capabilities for rapid testing, and they did a phenomenal job of getting that ready so that when community providers have a suspected case, they can quickly get them tested. And sometimes that confirmation was within hours, which meant we were faster at identifying actual cases. We were faster at being able to identify close contacts, getting folks isolated, and that just means getting them sort of in their homes and away from other folks so that they don't continue to expose other folks. With measles, it significantly impacts children. And we saw that play out across the country with other states and their outbreaks, that the vast majority of cases were children. In the end, the vast majority of our cases in North Carolina were children. And so our focus point became children. And when you focus on children, you also then have to focus on families and caregivers and child care centers and schools and pediatricians and other places and spaces where children are going to be. And so that became our priority population for communications as well. We have a saying, when they know us, they trust us. And that means when the community knows who we are, they trust the message that we're providing. And so we were able to work hand in hand with those local voices and those local experts. I've never seen measles firsthand. I've read about it. It was all theoretical in your textbooks, knew sort of the history of measles, knew the importance of vaccination, but at the end of the day, much of our provider population has never actually seen it. The second challenge, and I think this is a challenge for almost every public health event, outbreak, what have you, is quickly knowing how to communicate, and that knowing who and how we were going to communicate is always a challenge, and trying to do that as quickly as possible. And so again, that's where a lot of that relationship with local leaders and the folks who are not just working in their communities, they're living in their communities. Being able to pick up the phone and call Ellis and Buncombe and say, tell me what's going on, what resources do you need, where can we help? Do we need to bring in other folks? And even like Polk County, which is a smaller health department, and being able to pick up the phone. Like, these are people we know. These aren't just figureheads. Like, these are people we know. And that's based on a really long history and a really long relationship. And so I think that was a key factor of being able not just like the technical pieces of a partnership, but the real human pieces of a partnership, that we trust each other, that we believe in each other, and that we're all dedicated to the same collective vision of helping our neighbors be healthy and protecting them as much as we can. I think the community plays a really big role in helping to keep us all safe and help keep us healthy. The public is the backbone of public health, right? They are the drivers of health within our community. Take these reliable health messages and take them to your family, take them to your churches, take them to your schools, take them to the ballpark. Right? Help us carry that message forward. What I wish the community knew about public health and the work that we do, that we're your neighbors. We live right next door to you. I live here in Western North Carolina. I'm a resident of Buncombe County. And because we are living in your community, we care about it.